Not knowing who you are or where you are for moments at a time or longer can be unsettling. Though it's more common in seniors, disorientation can affect anyone. A number of things can contribute to it, including dehydration, reaction to medication, and infection. So how do we know if a loved one is experiencing this, Dr. Ray? What should we be looking for?
If they were fine yesterday and they're confused or disoriented today, that's not normal. That's not normal aging. That's not dementia, those things tend to be more gradual. So when it's sudden like that, that's a red flag for you. And the most common cause is delirium. That's a sudden change in the brain and makes people more disoriented and confused. And when that happens, I would tell people you want to look for red flags. I use a mnemonic, so I look for pain, I look for infection or injury, I look for nutrition, dehydration, even constipation or incontinence. Hypoxia, meaning lack of oxygen, medications can do it. And also look at the person's environment.
Well, and it can be devastating. I had a call from a daughter and they admitted her mother to the psychiatric unit. And you know what happened? She had a UTI. Of course, she was hallucinating, seeing things that weren't there, and she was in the psych ward. So it's really amazing to me. She continued to have chronic urinary tract infections. She was in her 90s. And so she ended up going on a low-grade antibiotic just to keep it at bay. But it can be really serious adverse circumstances if you.
So when you're older like that, small brain reactions, incidents, calls can be really, really big because their brain is so sensitive.
You have to remember any sudden change like that is a medical emergency until proven otherwise. So you can't discount the fact that you could have a stroke or a TIA. There could be that infection that you just talked about or the dehydration. Even your electrolyte imbalances, if your sodium levels are like in the tank, then your brain's not working right.
Right.
So I think people have to remember sudden confusion, that's the brain's alarm system.
That's right.
That's an alarm.
And I'm just thinking, what if people are isolated and they don't have people around them that are catching on to this?
Well, even when they do, unfortunately, a lot of people just discount it and say, well, this is just old age.
Yeah.
Old age doesn't change like that.
Right.
You know, it's not a quick slope. And so many people want to discount everything based on somebody's age instead of really digging into and finding out what is the why, what's causing this, and what can we do to solve it. You have to watch for these things. Get the right test, get the CBC, get the blood counts done, find out if it's an infection. If you think it was a TIA or a stroke, then follow protocol.
All right. We'll be back with more Aging Untold.